Hello everyone, in this video we'll be discussing the methods to study the skull. So there are basically two major methods, and these are external methods to study the skull and the internal methods. The external methods to study the skull, they include norma verticalis, norma occipitalis, norma frontalis, norma lateralis and norma basalis. This is norma verticalis. This is basically the top view of the skull. That means when we see the skull from above, it looks something like this. This view is called as norma verticalis. Norma occipitalis is the posterior view of the skull. When we see the skull from posterior or from behind, the skull looks like this, and this view is called as norma occipitalis. Norma frontalis is the frontal view or frontal view of the skull when we see the skull from the front. Norma lateralis is the lateral view of the skull, and norma basalis is the basal view of the skull when we see the skull from inferior side or from below. The inferior side or the base of the skull looks something like this. Coming to internal methods to study the skull, when we cut the skull or the roof of the skull horizontally, there are uh, we can separate the skull into skull vault and the skull base. So internal surface of cranial vault and internal surface of cranial base. When we cut the skull horizontally and remove the roof of the skull, the internal surface of the roof of the skull looks something like this. That is the cranial vault, and this is the internal surface of the cranial base. So cranial base also will be see the outer surface of cranial base is visible in norma basalis, and the internal surface of cranial base is something like this. Apart from these views, we can also study the skull by studying the individual bones of the skull, like studying occipital bone separately, frontal bone, parietal and temporal bone, sphenoidal bone and ethmoidal bone. That also we'll be including in upcoming videos. Coming to norma verticalis. Norma verticalis is, as I already told you, is the top view of the skull when we see the skull from the above. So it looks something like this. It is roughly oval in shape and broader posteriorly. Norma verticalis is broader posteriorly as compared to anterior aspect. Coming to what all bones are seen in norma verticalis, or when we see the skull from above, the bones which we can see is anteriorly there is presence of frontal bone. Then in the middle there are presence of two parietal bones. As we all know that parietal bones are paired bones and they are present one on each side of the midline. So these are the two parietal bones. And lastly, most posteriorly, we can see the presence of occipital bone. So these are the three main bones which are seen in the norma verticalis. Then coming to the sutures of this view, we can see that there are sutures present between these bones. The sutures are basically the fibrous joints which are present between the skull bones, and they do not allow the movement of the bones. So coming to first suture, anteriorly there is presence of this suture. This is called as coronal suture. Coronal suture is present between the frontal bone and the two parietal bones. After that, in the midline, we can see this suture. This is called as the sagittal suture. Sagittal suture separates the two parietal bones. And most posteriorly, there is presence of this suture. This is called as lambdoid suture. It is present between the two parietal bones and the occipital bone. In few individuals, that is approximately only 3 to 8% of individuals, there is presence of this additional suture which is seen between the two parts of the frontal bone, and this is called as metopic suture. It is not present in all the skull bones, it is present only in 3 to 8% of the individuals. Then we have done with the sutures. Then coming to these structures. There are two foramina which are present on either side of the sagittal suture, approximately 2.5 to 4 cm in front of lambdoid suture. These are called as parietal foramina. These parietal foramen They allow the passage of an emissary vein from the veins of the skull to the superior sagittal sinus. So, for the purpose of remembering, we can say that the parietal foramina allow the passage of emissary veins from the skull. The midpoint of these parietal foramina, in the middle of both the parietal foramina, there is a point in the sagittal suture which is called as obelion. Then there are two more points. First is at the junction of coronal suture and sagittal suture. This point is called as bregma. So, in the place of bregma, in fetal skull, there is a diamond-shaped structure which is a membranous gap which allows for the development of the bones of the skull. This diamond-shaped structure is called as anterior fontanelle, which is present in the fetal skull. And with time, this anterior fontanelle, it gets fused, and this point is after that this point is called as bregma, and it usually fuses at the age of 18 months, approximately 18 months after birth. Similarly, at the junction of sagittal suture and lambdoid suture, there is a point which is called as lambda. In fetal skull, there is, in the place of lambda, again there is a membranous space which is called as posterior fontanelle, which also allows the growth of the growth of the bones of the skull. And this posterior fontanelle, it fuses approximately at the age of 2 to 3 months after birth. With this, we have almost covered all the major structures of the skull. A few more things. We can see here that there are two lines seen both the sides of the norma verticalis. These lines are called as temporal lines. We will be discussing these temporal lines in upcoming slides. Now coming to one more thing, there is the highest point in the course of sagittal suture is called as vertex of the skull, which we can see in this view also, and in norma verticalis also we can see the highest point of the in the course of sagittal suture, that is called as vertex of the skull. Now, both the parietal bones, they are convex bones. So the highest point of the convexity of parietal bones are called as parietal eminence or parietal tuber. Clinically, it has an importance because it is the most common site of fractures of the skull. Now coming to the temporal lines, which we have already seen in the previous views of the skull. So the temporal lines are basically two lines, the superior temporal line and the inferior temporal lines. And they are present on both sides of the norma verticalis. Okay, so these temporal lines, they start from the zygomatic process of frontal bone and runs superiorly and posteriorly. They crosses the coronal suture, this is the coronal suture, and reach the parietal bone. In the parietal bone, this temporal line, it separates into two lines. First is the superior temporal line and second is the inferior temporal line. The superior temporal line, it goes superiorly and posteriorly, and it fades away in the parietal bone. And the inferior temporal line, it also goes forward and anteriorly, and then it goes inferiorly also. So these are the temporal lines. This is the temporal line which is starting from, this is the zygomatic process of frontal bone. So the temporal line starts from the zygomatic process of frontal bone. It goes above, it crosses the coronal suture. And then there are two lines. First is the superior temporal line, which runs in the course of parietal bone and fades away here. And this is the inferior temporal line, which goes posteriorly and downwards, and then it comes anteriorly and ends here. So these are the two temporal lines which we can see in norma lateralis also, and we are seeing it in the norma verticalis also. With this, we are coming to the end of this view, that is norma verticalis, and the other views of the skull we will be discussing in the upcoming videos. So thank you for watching this video.